A diagnosis of cervical cancer can feel overwhelming, but it is important to remember that you are not alone on this journey. Medical science has made incredible strides, and today, there are many effective ways to treat this disease. The first thing to understand is that there is no one-size-fits-all approach. Your treatment plan will be as unique as you are. It is a roadmap created just for you by your dedicated healthcare team. They will consider many factors, such as the specific type of cervical cancer you have, how far it has spread, and your overall health. This ensures the care you receive is tailored to give you the best possible outcome. Your personal wishes and life plans also play a crucial role in shaping your treatment roadmap. For many individuals, the desire to have children in the future is a very important consideration. Your doctors will want to have an open and honest conversation with you about this. In some situations, especially when the cancer is found at a very early stage, it might be possible to choose treatments that can preserve your fertility. This is a significant decision, and your medical team is there to provide all the information you need to make the choice that feels right for you, balancing your health needs with your future family goals. The stage of the cancer is one of the most significant factors that will guide your treatment. Staging is simply a way for doctors to describe the size of the tumor and whether it has spread from the cervix to other parts of the body. Cancers that are caught early and are still confined to the cervix often require less intensive treatment. As the cancer advances, the treatment approach may become more complex, possibly involving a combination of different therapies. Your team will explain your cancer stage clearly, helping you understand why they are recommending a particular path forward and what you can expect from it. Embarking on this treatment journey requires a partnership between you and your medical team. Think of them as your guides and advocates. It is completely normal to have a lot of questions, and you should feel empowered to ask them. Write your questions down before appointments so you do not forget anything. Understanding your diagnosis and the proposed treatments is the first step towards taking control of your health. Remember, this is a collaborative process. Your voice matters, and your doctors are there to listen, support, and navigate this path with you every step of the way. Your treatment roadmap may include one or more different types of therapy. The main options are surgery, radiotherapy, and chemotherapy, and sometimes newer treatments like targeted therapy or immunotherapy are used. Surgery involves a doctor physically removing the cancerous tissue. For very early stage cancers, this might mean removing only a small part of the cervix. In other cases, a hysterectomy, which is the removal of the womb and cervix, may be necessary. Your surgeon will explain exactly what procedure is recommended for you and what it entails, ensuring you are fully informed before making any decisions. Radiotherapy is another common treatment that uses high-energy rays, similar to X-rays, to destroy cancer cells. This can be delivered in two ways. External beam radiotherapy is when a machine outside your body aims the rays at the cancerous area. The other method is internal radiotherapy, also known as brachytherapy, where a small radioactive source is placed inside your body, close to the tumor, for a short time. Often, these two methods are used together to target the cancer as effectively as possible. Your radiotherapy team will plan this treatment very carefully to minimize the effect on nearby healthy tissues. Chemotherapy uses special medicines to kill cancer cells. These drugs are usually given through a drip into a vein, allowing them to travel throughout your body. This makes it a very effective treatment if the cancer has spread or is at risk of spreading. Chemotherapy is often given at the same time as radiotherapy, as the drugs can make the cancer cells more sensitive to the radiation, a combination known as chemoradiation. Your oncologist will explain the schedule for your chemotherapy, including how often you will receive it and for how long the treatment course will last. In recent years, more advanced treatments have become available. Targeted therapy uses drugs that are designed to attack specific weaknesses in cancer cells, often causing less harm to normal cells than traditional chemotherapy. Immunotherapy is another exciting approach that works by boosting your body's own immune system, helping it to recognize and fight the cancer cells more effectively. These therapies are typically used for cervical cancers that have spread or have come back after other treatments. Your medical team will determine if you are a suitable candidate for these newer options based on tests done on the cancer cells. Your recovery journey will depend on the type of treatment you have had. After surgery, you can expect to spend a few days in the hospital. The medical staff will help you manage any pain and encourage you to start moving around as soon as it is safe to do so. Once you are home, It is important to rest and allow your body to heal. You will be advised to avoid heavy lifting and strenuous activity for several weeks. Returning to work and normal activities will be a gradual process, and your team will give you a clear timeline. It is also important to wait until your doctor gives you the all clear before resuming sexual activity, usually around 6 weeks post-surgery. If you have had radiotherapy or chemotherapy, you may experience side effects during and after the treatment period. Tiredness is very common, and it is crucial to listen to your body and rest when you need to. Other side effects might include feeling sick or having an upset stomach, but your team can provide medicines to help manage these symptoms. It is important to eat well and stay hydrated to support your body's recovery. These side effects usually improve gradually in the weeks and months after your treatment course is completed, but it takes time for your energy levels to return to normal. Some treatments for cervical cancer can have long-term effects. One possibility is lymphedema, which is swelling, usually in the legs, that can happen if lymph nodes were removed or treated with radiotherapy. Specialized physiotherapy can help manage this. You might also notice lasting changes in your bladder or bowel habits. Another significant consideration is that many treatments can affect fertility and may trigger an early menopause. This can be emotionally challenging, and it is something your team will discuss with you in detail, offering support and options like hormone replacement therapy if it is appropriate for you. Navigating these long-term changes is a key part of your recovery. It is vital to maintain open communication with your healthcare team about any new or ongoing symptoms you experience. Do not hesitate to tell them about physical discomfort or emotional distress. There are many ways to manage these side effects, from physiotherapy and dietary advice to counseling and support groups. Your team is not just there to treat the cancer, they are there to support your overall well-being as you heal and adjust to life after treatment, helping you to achieve the best possible quality of life. Going through cervical cancer treatment is not just a physical challenge. It can be an emotional roller coaster too. It is completely normal to feel a wide range of emotions, including fear, anxiety, and sadness. Talking about these feelings is an important part of the healing process. Your medical team, including specialist cancer nurses, can be a great source of emotional support. They can listen to your concerns and connect you with professional counselors or psychologists who are experienced in helping people navigate a cancer diagnosis. You do not have to carry this burden by yourself. Reaching out is a sign of strength. Connecting with others who have had similar experiences can be incredibly helpful. Patient support groups, whether online or in person, provide a safe space to share stories, ask questions, and learn from one another. Hearing from someone who has walked a similar path can make you feel less isolated and more hopeful about the future. Charities like Joe's Cervical Cancer Trust in the UK offer fantastic resources, including forums, helplines, and information, all designed to support you and your family throughout your journey. Sharing experiences can be a powerful tool for coping and feeling understood. After your main treatment is finished, your journey with your healthcare team continues. You will have regular follow-up appointments, which are very important. These checkups are an opportunity for your doctors to monitor your recovery and check for any signs that the cancer might have come back. At first, these appointments might be every few months, and then they will become less frequent over time. These visits are also your chance to discuss any lingering side effects or concerns you may have, ensuring you continue to receive the care and support you need to live well. Moving forward after cervical cancer is a process of rediscovering your new normal. Be kind to yourself and allow yourself the time and space to heal, both physically and emotionally. Embrace the support systems around you, your medical team, your family, your friends, and fellow survivors. By staying on top of your follow-up care and prioritizing your well-being, you can look towards the future with confidence. Your experience is part of your story, but it does not define you. You have taken a brave and proactive step in managing your health, and that is something to be proud of.